Axial.
Axial is one, good. Horizontal. So any of those three terms can be significant. However, we understand the orientation of transverse or horizontal. One thing that I need you to understand, in cross-sectional, axial is the only term that is sufficient. Got it? We know the orientation. We know that it was a horizontal plane that sliced through that patient, okay? Axial is the term of choice in cross-sectional imaging. So when you go through imaging, you're going to be able to identify the type of plane that sectioned this patient. And so this is why it's called cross-sectional imaging. You're going to identify the projection or the image based on which plane sliced it. Make sense? Yes? Okay, so let's start picking up some ideas. So we know what our mid-sagittal plane, what does our mid-sagittal plane do? Let me pick on somebody. Miss Betty, what does our mid-sagittal planes divide?
It divides the left and right parts.
Left and right part, but the mid-sagittal plane does what? Does more than that.
Equally.
So here we have, and we see the word longitudinal. What does the word longitudinal mean, Aurora?
I know what it means. I just don't know how to explain it, how to put it into words, Miss Laura.
No problem. And thank you. We have the body. We have the patient. When you think of a longitudinal plane, you think of the longest distance of the patient's body. So when we're looking at the orientation, especially like either of the table, right, or the patient's body, you're going to lie the patient long ways or longitudinally along the longitudinal axis of the table, right? You wouldn't place the patient sideways. Her head would hang off and her legs would hang off. Make sense? So when we think of a longitudinal plane, we think of the longest plane of the objective. Okay? Everyone understand that? The longitudinal plane is going to travel from the longest orientation of the patient. Okay? We know that the transverse plane or horizontal plane, but how do we know it here in cross-sectional?
Axial.
Axial is going to be the shortest plane, right? It's going to be the shortest. It's not going to be a longitudinal plane like the mid-sagittal or the mid-coronal or a sagittal or a coronal. The axial plane is going to be from anterior to posterior. Make sense? Good. Now, let's talk about surfaces. I put this information in here. I just copied and pasted from what is a sagittal plane, what is a coronal plane, what is the significance about them. We've used them to help us in position. If I say place the mid-sagittal plane parallel to the image receptor, what kind of projection is that, John? If I say place the patient's mid-sagittal plane parallel to the image receptor on the upright bucky, what projection is that?
I guess an AP projection.
Mid-sagittal, bucky, parallel?
The lateral.
Beautiful, good job. And so when you think about that, you have the ability to go back and use your planes in reference to how they're being placed next to the image receptor. And CT or MRI, the reference points doesn't change. For us, we can either go to the wall bucky, we can go to the table, we can go to the tabletop. Our image receptor can travel basically around the room, correct? Yes? Perfect. But in CT and MRI, it doesn't. It doesn't travel. We will always lie the patient recumbent onto the couch. That's called the couch or the table of the CT and MRI room. Sonography also uses sectional imaging. When they're using the transducer, they're not taking holistic type of images like we are. We're going from anterior to posterior, lateral to lateral, or oblique. Sonography can use the planes, however, they are also taking slices. So they're mindful of their depth, the thickness of the slice, and what they're trying to image. So these three modalities, CT, MRI, and sonography, are going to use sectional imaging, where we're more of a holistic view. Okay? So if you take a chest x-ray, what do you see in the chest x-ray, Asias? Name some parts.
Like heart.
Heart, lungs, whole lungs, right?
Yes.
Apices down to costophrenics, down to the hilar regions, right? Medial to the hilar region. So we're seeing a whole view. Yes, we're eliminating the skin, and yes, we're eliminating so on and so forth, but we're seeing whole pictures. When we look at sectional imaging, it is going to take it into slices, kind of like taking a turkey and slicing off a piece. Make sense? Yes? All right. So a sagittal plane is a longitudinal plane, meaning it travels from the head down to the feet, that divides the body into right and left parts. That could be here, that could be here, and it can be here, right? And we're going to see that. However, the mid-sagittal plane or the median plane, mid-sagittal plane or the median plane, divides the body into equal left and right parts. I know that this is review, okay? But why do you think this is going to be important?
We're talking about cross sections and imaging.
Right. Yeah. Let me ask this question. You have spent some time in rad procedures discussing levels, right? What do levels mean? When I say go to the level of the iliac crest, what does that mean? And which plane am I referring to?
Iliac crest. Plane, I said that would be axial plane.
Go ahead, Naomi.
Axial plane.
It is an axial plane. So levels are always, when I say the level, we're not talking about the vertical axis of the central ray. We're talking about the horizontal axis of the central ray. Most of the time, we'll put this axis where on the chest of the central ray.
7.
MSP.
This line of the central ray, or the vertical axis, is always going to be placed to a either coronal plane or a sagittal plane. Make sense? So you're looking for a longitudinal plane. This is a longitudinal plane of the CR. The horizontal plane is T7. Why do we use T7?
It's mid-thorax.
It is mid-thorax. So we place our central ray at the MSP at the level of T7 so that we can encompass the entire thorax. Perfect. So we know the mid-coronal divides the body into equal posterior and anterior parts. The horizontal axial plane is a transverse plane that travels through the body at a right angle to the longitudinal plane. So when we think of right angles, what degree is that
90.
90 degrees. So a horizontal or axial plane is going to cut the longitudinal plane by 90 degrees. Make sense? Anything that is 0 parallel or right angle, 90 degree, anything other than those numbers, we have an oblique plane. Now, do we take cross-sectional images in oblique planes? Absolutely. Because a lot of the objectives don't travel from superior to inferior in the same plane. Make sense? Ligaments travel at a diagonal. Organs don't lie upright all the time. They may lie semi-recumbent. Make sense? And so sometimes we have to go back and oblique our imaging so that we're able to see the better parts of the organs. Any questions there about the planes? So here we have it. Here we have what you have in Bontrager. So if you want to go back, you can go back to see what is a median plane, what is an axial plane, what is a coronal plane. Now, you're going to have to pay attention to these types of planes because what does the coronal plane divide, Luke?
Posterior and anterior.
The body anterior and posterior.
So will we be able to see the left and right side on a coronal?
No, not specifically.
Tell me why.
Because it's viewing the front and the back.
So if I get divided here, and I have my ankle surface, will you not be able to see my left and right shoulder?
Oh yeah, you can see that. Okay.
This is going to be important. Thank you, Luke. Sharon, what if I divide myself sagittally, mid-sagittally? What is going to be demonstrated, or what will be eliminated?
You will be demonstrating like equal left and right.
Will I?
You
So
said
if I divide myself in mid-sagittal, I will have removed my right from my left, correct?
Yes.
I will not see my right from my left. However, I will see my anterior and posterior. Does that make sense?
Can you repeat that?
Okay. So talk to me, Daniel. So if I divide myself mid-sagittal plane, will you see my right and left side like we did on the coronal?
Yes.
Think about it. If I divide myself right here, does my right side go away? Or my left side go away?
No. Sorry, no.
If I was a cake, Daniel, and you were going to slice me down and separate me, did you separate my right from my left?
Yes.
Oh, yes. Okay.
Okay, good. So you've separated. Now you've got my left side. Do you still see my anterior and my posterior?
Yes.
Perfect. We couldn't see that on coronal. Right? Because on a coronal slice, I removed my anterior, right? But you could still see my left and my right. This is going to start making sense here in a minute. Now, if I'm a cake, and I am laying recumbent, and I slice axial from anterior to posterior, and I separate. What did I separate? Donan.
Inferior and superior.
Woohoo! Inferior and superior. So look at your planes. If I divide this patient and I sever the patient, I am removing superior from inferior. If I take the mid-coronal plane, I will slice it through the patient. I have separated anterior from posterior. Okay? If I take the median plane and slice longitudinally, I will have separated one lateral from the other lateral, one left lateral and one right lateral. Make sense? Because this is my lateral and this is my lateral, correct? Yes, no, positive. Anatomic position. This is lateral, right? This is lateral. This is lateral. So good. So why are we spending so much time here? Because this, ladies and gentlemen, is what you will recognize. I'm not interested right now in you identifying the corpus callosum, the medulla oblongata, the pons. I'm not interested in that. That's coming. But what I need you to understand is what sectional anatomy is this? So the patient was divided sagittally. I divided the patient, or I sectioned out sagittally. I can still see anterior, here's the nose, and I can see posterior surface because here's the back of the head. However, everything else that was sliced off is not there. Make sense? Good. I'm going to jump to coronal. So the patient had a longitudinal slice across the head. Here we have the brain. Okay? Here we have the patient's left side, and here we have the patient's right side. So the orientation on how we view the patient is still the same as radiographs. I'll say that again. How we view the patient on a coronal and a sagittal is how we would orientate on a radiograph. So the patient is looking at us. This is the patient's left side, and this is the patient's right side. Left side, right side. Okay? Patient is facing this way. We know that this is going to be the right side. Questions so far? So on the coronal plane, we do not see the anterior and posterior like we see on the sagittal plane. But what's missing from the sagittal plane is we don't see both laterals. Left and lateral right. Make sense? So each section, just kind of like the AP and the lateral, gives us different views or projections of different surfaces. Okay? Mid-coronal plane, mid-sagittal plane was used to slice. Questions? This is the time. No? Easy? Okay, great. So axial. Axial, again, is a horizontal plane. Axial is a horizontal plane. It went in anteriorly and exit posteriorly. So when we're looking at these images, and I want you to remember, these are not holistic. It's like taking a slice of cake and only seeing that cake, that one slice. You're not seeing superimposed of the vertex and the rest of the occipital bone. You're not seeing all of that, okay? It's just like you're taking a slice and you're looking at it. When we look at an axial image, we will view it inferior to superior. When we view an axial image, we are viewing inferiorly to superiorly. That gives us the orientation of which side this is. So what side is this?
Is that the right side?
Think about it. Inferior to superior. Lay yourself recumbent. Turn your body this way. The left. Think about it. I don't have my skulls.
That's the left side?
Good morning, Miss Bang. Hi. Okay, so here we have. Can everyone see this? Yeah? Not doing it in my. So there we go. Okay, let me make sure I'm on it. Okay, so when we think about it, here's your sagittal, right? When we remove, we would see this. This is what we see here, don't we? It's just black and white, but we see a slice. When we think of something coronal, we would be removing this part of the face forward, right? So we would only see right and left, but we would be removing sections of anatomy. When we do axial, these are the patient's eyes. Here we have the eyes. Here we have the nose. Here we have the back of the head. So the patient is lying just like this. So this is the patient's left side, and this is the patient's right side. You are looking from inferior to superior. So the patient is like this. Make sense? You have to know this. You have to know this. You have to be able to identify images. Tell me if they're coronal, axial, or sagittal. Questions?
That's sagittal view there. So you said that's the right side. So they'd be standing right lateral.
They're all gonna look. Yeah. We'll just do it that way. Right lateral.
No, okay.
It's not going to be of importance. It's going to be at what level or what slice. Now, we're about to get to them. Well, maybe not today. I want to make sure we're here. And I'm going to say what you're going to identify. Now, if we say a sagittal, this patient was sliced sagittally. There's going to be internal landmarks. There's going to be bony landmarks that is going to determine the relevant area of slice. Okay? So what the mid-sagittal or sagittal slicing will either be referenced to most medial or lateral. I know this is going to confuse you guys, but just write it down for right now. So what is most medial versus lateral, or what is lateral versus medial? Because we are using a sagittal slice. If I sliced here, this is most medial. This is my median plane. But if I sliced here, this is lateral, right? Compared to what I just gave. If I slice here, this is more lateral, right? Because I'm going to see a scapula versus a vertebrae. So you're going to be able to determine on a sagittal projection what is most medial versus lateral, because that's what sagittal imaging does. You slice the patient from left to right.
So based on that, would you be asking us like let's say we have an exam and you're giving us an image, are you going to ask us to write like lateral sagittal? No, that doesn't make sense.
Sagittal.
Just okay. Thank you.
But I thought you were going with Aurora. If I give you two images, which one is most lateral? You identify the image. Which one is most medial? You identify that image. Two sagittal images. You tell me which one is most medial and which one is most lateral. How do you determine? By anatomy. Make sense? Good. So let's go to axial image. We know that this is of the head. We're going to cover 3 sections in Introduction to Cross-Sectional Anatomy. We're going to cover the head, the thorax, and the abdomen. You're going to have a relevant familiarity with some of the major organs in those regions. Chest and abdomen, you've covered. We're going to cover a little bit of the brain. Not too much, but some of it. Some of the major key points. Make sense? But here we see eyes. Point to your eyes. We know that once we get to the eye level, we are more superior than the mandible. Make sense? What if we see no eyes and we see the top of the head? We know that we're more superior. It says more superior axial projection than at the eye level. So you have to start taking into consideration levels at the nose level, at the eye level, at the vertex level, at the mandible level, at the hyoid level. Make sense? These are levels. You've kind of started. You told me T7. That's the level. That's where you place the horizontal axis or the axial. Make sense? Good? Now, coronal.
Sorry to interrupt you, Miss Laura. I have a quick question.
Mm-hmm.
For axial, before you move on, are we always looking at axial from the bottom, like as if we're looking up?
Inferior to superior.
Inferior to superior. Okay.
Bottom to top, inferior to superior.
Thanks.
Okay, so this side right here, Naomi, with that into consideration, what side is this, left or right?
So that's the left side.
Good, because eyes are up, right? The patient is recumbent, so the eyes are up. This is the left side. Perfect. Coronal. How does the patient get sliced coronally? Right? From anterior to posterior. So if we are moving away from the anterior and slicing more posteriorly, we would be able to say, by identifying anatomy, what lies most posterior versus anterior. So here we see the brain. Like I said, we're going to go over some of the anatomy of the brain. Not a lot, because it's very, very detailed. But some of the major organs that are identifiable to determine the posterior versus anterior. We don't see a mandible. Really don't even see bony anatomy, except for the vertebrae right back here, the vertebrae. So we're going to start using those landmarks. Just like you were able to see pathology on holistic radiographs, you're going to be able to identify anatomy on sectional imaging. But most importantly, starting with step 1, that you identify what type of cross-sectional image it is. So if I remove, because I will, remove these words, you would have to go back and label it, identify it. Make sense? So, when you're thinking about splicing, and whether you're looking at it in an axial view, whether you're looking at it in a coronal view, or whether you're looking at it in a sagittal view, I will say this. CT and MRI always scans the patient axially And then everything else, the coronal or sagittal, is reconstructed. When a person goes into the CT unit or MRI unit, it's one direction imaging, axial. But they will go back and take all of these axial projections and reconstruct them through algorithms, computer algorithms. We'll go back and reconstruct them into a sagittal projection or a coronal projection at the request of the physician. Most of the times when you go into CT and MRI, you will be viewing radiographs or cross-sectional imaging in axial form. Now, what other software advantages do we have? There's 3D reformation, multiplanar 3D reformation, where we're able to go back and we're able to see a three-dimensional type imaging. This is not how it was captured. It was captured in axial imaging. The software enhancements from reconstruction starts to redefine what the holistic image looks like. Isn't that amazing? That is where a lot of our software advancements are coming from. It's just computer applications. It's not the way we're doing it, right? It's how we're reconstructing it, the ability to. Make sense? I'm going to pause for just a second and allow you to catch up with me, ask questions. This is a whole new ballpark, right? I don't know how much Mr. Donahue went through 3D imaging, or not 3D imaging, cross-sectional imaging. Should have been just kind of surface, superficial. Yes, no, possibly. No, he went through it in detail, Jonathan?
No, we haven't gone over this at all.
Oh, okay. Okay. It's in chapter 1, very, and he knew I was going to get to cross-sectional imaging. So, multiplanar reformation in 3D, when you guys go in, like I said, MRI, CT, and sonography has the ability to, software applications, computer applications are always enhancing how we view our images. It's only a matter of time. Color is so much infiltrating in our software applications that we're getting used to seeing color on radiographs. Before, monochromatic, black, gray, and white, as we're studying in PRE, black, gray, and white. But black, gray, and white is how we, as radiographers, are programmed to look at images, to identify, to see energy being attenuated, right? What does attenuation mean?
Reduction of X-rays.
Attenuation.
It's the reduction of energy in photons. The amount of photons.
Good job. Way to go, Justly. I like it. So we're so used to seeing energy attenuated in a monochromatic form, but in all of these advancements, we're starting to introduce purple lungs, green, red arteries, blue veins. You're starting to apply where you're not trying to look at energy, any energy anomalies, attenuation anomalies can now be identified in orange. It's amazing to me. It's amazing to me. You're not looking for those subtle differences in shades of gray. So it's amazing to me. So I'm super excited. So again, when you're taking an object whole, like the brain, you're taking an object just like this, right? You're taking an object just like this, whole. It's a cranium, it's a sphere, or the body. You're taking slice imaging, and how you slice through the body determines what you're going to see. For coronal, how anterior versus posterior. For the axial imaging, how inferior versus superior. For sagittal imaging, how lateral versus medial. I know, write it down. Write it down. I'll say it again. Coronal how anterior versus posterior. How anterior versus posterior for coronal imaging. For axial imaging, how inferior versus superior. Axial imaging, inferior versus superior. And sagittal, how lateral versus medial. For sagittal, how lateral versus medial. Now, why is this such a big deal? What are we looking at? What kind? Oh, hold on. These are the colors I'm talking about. But what cross-sectional image is this?
Coronal?
It is coronal. Very good. Very, very good. It is coronal imaging. Now, we are relatively posterior because we're going to see the inferior vena cava. We're also going to see the vertebral column. Where does the vertebral column lie? Closer to the posterior surface or closer to the anterior surface?
Posterior.
Posterior?
Good job. So this is a good insight of what the expectations are. However, your images on your exams are going to be monochromatic, black, gray, and white. Okay? As you have been used to identifying organs, anatomy, correct? We've invested a lot of time into learning what a lung looks like versus a heart, versus a liver, versus a bladder or kidneys. Make sense? Any questions? So, vertical or longitudinal axis is either going to slice the patient sagittally or it's going to slice the patient coronally. A transverse is going to intersect horizontally, or an axial plane is going to intersect horizontally at right angles. Got it? This is the point of going back over your planes so that you're able to identify what you're looking at. Will you also have to go back and start learning some new anatomy and refreshing what you do know? Absolutely. Absolutely. What is this that I'm pointing at right here, Jolie? What organ is that?
Is it heart?
It's on the right upper quadrant of
Liver?
the patient. I didn't hear you, Jolie.
Liver.
Liver?
Perfect. Good. It's son, right here. What is this?
Spleen. Or stomach.
Look at this big hollow sac on the left side B. That has stool inside. Huh?
Sorry, I don't get it. I don't.
Okay, help him out, someone. What is this hollow sac on the left? Yes, Aurora, the stomach. Perfect. Good. Ooh, you're in this unit right now. Bonnie, what am I pointing at right here?
Is it the femur? Left
Femoral
femur?
head.
Femoral head.
Yes, femoral head. Perfect. Sharon, what is this? Look at this bee that is traveling from superior and inferiorly alongside of the vertebrae.
Is that the instant?
It's not intestine, it's a muscle that travels alongside either side.
Is this less muscle?
Which one, right or left?
The right?
Very good. Thank you, Aurora. All right, let's see. Ooh. This takes on a specific shape. Does anybody want to know what this is?
The bladder?
It looks like the bladder initially, but it's kind of so posteriorly because remember, we're seeing vertebrae. Anus.
Oh,
The rectum. I'm sorry, the rectum. The rectum. Going close to the anus. That is the rectum. Good. So you see where we're going with this? So you do have to become familiar. So in your PowerPoint, these are the different types of cavities that we will invest the next few weeks in learning. However, you already know where the heart, the great vessels, trachea, esophagus lie, the lungs, the membranes. What you really need to start paying attention to is levels. Where does the apex of the heart lie? At what level? Where does the trachea bifurcate? What level does the bifurcation happen at? You should know that one. What is it?
T5.
T5. Perfect. T5. So that is at that level. Good. So if you see the bifurcation at the trachea, you know you're relatively at T or thoracic vertebrae number 5 as you are traveling axially. So this is where I'm going to stop. This is where I want you to start going and taking the initiative to go back and start learning your anatomy. Okay? You have Friday to go back and start reviewing your anatomy because I may just have a little pop for you on Monday. Make sense? Perfect. Review your levels that you do know so that we can spend some time learning new organ. Yes? Any questions? I totally understand that this is brand new to you. Brand new. You're going to be introduced a lot of brand new things, right? Make sure that you stay on top of the information and ask the questions that you need so that you can be stronger. Are there any questions? No? Don't get overwhelmed. We still have time. We still have time. But if you can find something like a doll or something, start thinking about these planes, okay? Sagittal, coronal, axial, so on and so forth. Okay? Any questions? All right, well, I'll see you in a little bit. Bye.